Hello, my name is Dorian Damon. I'm an evidence-based and holistic integrative psychotherapist practicing out of New York. This time of COVID-19 has been very challenging for many. Kids being taken out of school, losing peer connections and relationships, adults having to either work from home and taking on the responsibility of not only parent, but also teacher, or some of us losing jobs, losing loved ones, so on and so forth. The COVID-19 has resulted in many things connected with loss and us having to practice aspects of non-attachment and acceptance as a whole in society. This can be very difficult for all of us, particularly the young ones who have limited experience with this, and they're still growing to understand. So some words of encouragement are as follows. Just continue to engage in whatever routines that you found healthy. And this can be a sleep-wake cycle. If you were waking up and going to sleep at a particular time before COVID, that would continue to be strongly encouraged. Diet is also important. If there is particular elements of your diet that have changed during the COVID-19, continue to be mindful of what these are and how they're impacting your mood and your functioning is also going to be helpful. Continuing to shower and shave and all of the activities of daily living when it comes to our hygiene and whatnot that take place when COVID-19 or prior to COVID-19, these things are all helpful. In addition to these things, is kind of being mindful. What's also encouraged is being aware of the signs and symptoms of clinical depression or clinical anxiety. Clinical depression and anxiety can be identified as those symptoms that make it difficult for you to engage in your everyday routines. And these routines oftentimes have changed since COVID-19, but these are the kind of symptoms of anger, of irritability, of frustration, of annoyance, of isolation, of withdrawal, of just general feelings of being overwhelmed or unable to manage, feelings and thoughts of wanting to escape or not be present, or just wanting to run away. These are all normal parts of the human condition, and I'm here to say that don't be afraid of these things. If you do need assistance, reach out, get support. There is plenty of it out there, and not just assistance from your family and your friends, which can provide support at the non-clinical level when it comes to us managing our anxiety and depression. But when it gets to the clinical level, please, please, please seek professional help and assistance, as trained clinicians are enough trained to help you alleviate these issues. So places or institutions like SAMHSA, the Substance Use and Mental Health Administration, phone number 1-800-662-4357 is one organization that you can contact to find support in your area. Another one is NAMI, the National Alliance on Mental Health. Phone number is 1-800-950-6264. Is another nationwide organization that could assist you with finding professional assistance. Lastly, you can utilize such resources as Psychology Today, which you can identify a therapist or a counselor in your area based off of zip code that will be able to provide you with support and assistance. Most therapists nowadays are accepting insurance, but most will oftentimes find some sort of way to produce some sliding fee scale to offer you support in this time of need. Remember, you are not alone in this. Everybody needs somebody, and just because you have to reach out to a professional for additional support and assistance is not a sign of weakness, it's a sign of strength.